The perinatal period can be one of the most joyous, but also most stressful experiences people go through in their lives. At the same time, psychiatric treatment is extremely low in this population, with many issues going uncared for. To talk us through this issue, I'm joined by Dr. Diana Clarke and Jonathan Alpert.
Okay, we're excited to be here.
Let's start off. How does pregnancy, or how can pregnancy affect mental health?
So pregnancy creates a number of stressors in people's lives. It's both a very happy time, but also a time when somebody needs increased psychosocial supports, and often people don't have those supports. It's also a time of significant biological change. So many of the endocrine changes and hormonal changes during pregnancy predispose toward mental health problems, particularly if somebody has a history of mental health issues in the past or substance use disorder problems. So it's a time of both elevated happiness and a time of elevated risk for mental health and substance use problems.
And how common is that? How often do those issues appear?
It's quite common. Mental health problems and substance use problems are highly prevalent in the general population. There seems to be an elevated rate of both mental illness and substance use during the time of pregnancy and shortly postpartum.
And I know you've conducted a study into this. Haven't you? Tell us a little bit about the study.
So the study came about with pregnant persons reporting anecdotally that when they if they have mental and substance use disorder issues and they want to become pregnant or they do become pregnant, that they're being dropped by their behavioral health providers. And part of the issue that came up, and the CDC Foundation had this request for proposal to kind of address this issue. Is this real? And so the project came about where we really wanted to understand this issue. Is it real? And we really wanted to understand it not just from the pregnant person's perspective. We wanted to understand it from the behavioral health provider's perspective. And when I talk about behavioral health providers, I'm talking about psychiatrists, psychologists, nurse practitioners, counselors, social workers. And so we wanted to understand it from all of those perspectives using a different kind of methods. So we wanted to do focus groups where we hear the issue from these different groups, and then also collecting from survey data to kind of understand the issue quantitatively. Does this make sense? So that's what we've actually done. And the project itself has been guided by a panel of experts, including researchers and clinicians who focuses on perinatal mental health. And Dr. Alpert is the chair for that advisory panel that we do have.
And what did you find?
So some of the issues that we do find, we do hear pregnant persons saying, yes, when I do have mental health issues, sometimes my provider focuses on the obstetric care and doesn't necessarily pay attention to the symptoms that I'm reporting. And some people have actually talked about when I go in and I'm pregnant, if I'm on a medication, sometimes my provider will stop that medication and nothing is done thereafter. And so I have to struggle with these symptoms. And so we found that in our focus group material, some just the information that we got from interviews, but we also found it in the survey data.
Did you find that women through pregnancy got psychiatric support they needed?
There's a lot of variability among providers in this level of comfort, and that was something that came across in focus groups. Some people have had training. They feel pretty confident about their ability to continue treating people who they treated before who are now pregnant, or to accept new patients who are pregnant or postpartum. Other providers don't feel that they've had access to the training that they would need to feel comfortable, and don't have people in their area, particularly in rural areas of the country, don't have access to people they can refer to who have the expertise that's needed. And so those people who are pregnant or postpartum who are treated by people who don't feel comfortable fall through the cracks because they really don't have anybody in their circle who has the expertise that's needed.
So I know you're doing a session here at the conference. What's your message going to be to delegates here?
Perinatal mental health care really matters. It matters for the birthing person, the person carrying the child, and it also matters for the child, the fetus. And so it is important for these perinatal mental health issues to be taken care of. And that the fact that we do have gaps in care, we have gaps in training. And as an organization, that train psychiatrists or a professional organization, it is really important for APA to be at the forefront in kind of guiding some of those training needs that are necessary.
Thank you both so much indeed for joining us. Really interesting. I hope the session goes well, and thank you.
Thank you so much.